on 5. There are concerns tonight over the mosquito-borne illness Zika in the U.S. and around the world. The disease is of high concern, especially for pregnant women. Those who are infected have given birth to babies with abnormally small heads. News 5's Alan Carter spoke with a mosquito expert who happens to have grown up right here in Mobile, and he says the highest concern around Zika is no hype, and there's a real threat it could show up here.
Our neighboring state has become ground zero in the fight against Zika in the United States. A dozen cases in Florida of the mosquito-borne illness, prompting Governor Rick Scott to declare a state of emergency in 5 counties, including Santa Rosa.
We have to ensure that Florida is safe. Just like in a hurricane, what we always say to ourselves is we're going to prepare for the worst and hope for the best.
In all but one U.S. case, Zika was detected in persons traveling abroad. That lone case of local transmission was in a woman who had sexual contact with a partner who traveled out of the country. But that's no cause to sleep on this virus.
I hope there's no one out there who would say that this virus is not of major health concern.
Dr. Nathan Cadena's life work is studying mosquito-borne illnesses. A graduate of Auburn and LaFleur High School, now a professor at the University of Florida. And he talked to us via FaceTime.
In Florida and other southeastern cities such as Mobile and New Orleans, we have the mosquitoes that are capable of transmitting the virus.
And all it takes is for one of those mosquitoes to come in contact with an infected person to cause problems.
So that means that mosquito, which is homegrown here in the southern United States, bit someone who's infected with Zika virus, and then several days later, they bit you and infected you.
Thus far, there have not been any cases of Zika reported in Alabama.
We reached out to the Mobile County Health Department to see if they have tested any mosquito samples for the virus and what those results were, but they did not respond to our request.